the sessions where we are organizing for the students in order to bring awareness about the various courses, especially offered under the School of Management. We call it as AUSoM, Anurag University School of Management. We have eminent personalities. So here we have the head of the Department of Master of Business Administration, Dr. V. Vishnuvandana ma'am, who is an associate professor and also heading the department. She has got more than 2 decades of teaching experience, and she has done a lot of projects from the DST and UGC research projects, and she is also a certified mentor from BYST and UK guilds, and she's a person who is training many people and doing many projects, and she's been under Entrepreneurship Network, Vadvani Foundation. She organizes a lot of FDPs, and she's a resource person in many organizations. She goes over there as a resource person. We welcome V. Vishnuvandana ma'am, head of the department, Anurag University, School of Business Management. Welcome you, ma'am. And we also have Dr. Arundhati Mamdi ma'am, who is a principal consultant and professor of practice at Anurag University. Dr. Arundhati Mamdi ma'am is a program manager and also principal consultant with over 3 decades, 30 years of experience in healthcare and IT industry. Currently, she is the program director for healthcare management program at Anurag University. She's a visiting faculty for quality and healthcare IT in healthcare management programs at various organizations like ASCII, Chitkara, HCU, etc. And she's a part of audit programs conducted by Government of Telangana and quality assessments, and mm, participates in initiatives of healthcare implementations and projects. We do have a lot of many people who have been there from the School of Management who has also joined. I acknowledge all the presence of the uh, professors and professors of practice, and also the other eminent personalities who have joined this webinar. Now, this webinar objective is mainly to talk more about the opportunities in MBA Healthcare Management. So this batch we are going to start from this year onwards. So we thought of bringing some awareness related to this, as we know that no, there's a lot of difference between various schools. Not Anurag University, we have got six schools. One is School of Engineering, and we have got School of Management, we have got School of Pharmacy, we have got School of Agriculture Sciences, School of Nursing, and School of Medical Sciences. So like that, we have got almost six schools, and I can say that those School of Management is something unique. And they do a lot of innovative practices in the sessions. Now I invite Vishnuvanda ma'am to talk more about the school and also the programs that are offered over there, and a little bit throw light on this healthcare management too. I invite Vandana ma'am to speak. Vandana
You're
ma'am,
on mute.
Vandana ma'am, could you please unmute yourself and speak?
Professor Vandana, you have to unmute yourself.
Yes, sir, I'm trying. Hello.
You're audible, ma'am. Please go ahead.
Uh, Good evening, sir. Thank you for the opportunity. As you are aware, School of Management of Anurag University has, we call it as the most happening school or B school, basically for various reasons. One is because of the industry relevant curriculum that we do, which is updated very regularly, very frequently. We update it almost yearly. And second one is the industry members we have in our school. We have almost around 10 faculty, 10 professors of practice who are from varied fields, right from electronics to manufacturing to service industry to software and so on. So who all are from CXO positions, who held in HR, finance and all in CXO positions. And so that gives them complete industry exposure to the students when they read. And third one is the kind of a learning, experiential learning that happens in the school, where they try to do our thing is practice, teach only what you practice. So it is like they have to work hands-on rather than listen to many of the things. So they work in teams, they run their micro enterprises, they do lots of internships and projects. Every alternate term, they have to do a project internship with the company, including BBA and MBA. And the programs we are offering are BBA Honors, which is a 4-year program, MBA General, MBA Business Analytics. And this year, we are also offering MBA Healthcare Management and MBA BFSI. Why MBA Healthcare Management is it's a very rapidly growing industry, which Arundhati ma'am will be speaking shortly on. And second, we have a extremely good faculty also in healthcare. Arundhati ma'am herself is a consultant in hospitals and healthcare, even to government, she was consultant sometime. And we have our own hospital, Nilima Hospitals, where the students can get exposure, and also we are having access to various other hospitals. So we thought this will be a very good uh, service to the country and also to the students, because that's a uh, it's being a university, it will give them opportunity to integrate and collaborate with various disciplines, and also work hands-on with our kind of a curriculum and learn from the experts, and they'll become very good healthcare professionals, which is the need of the country now. So this is what about the school right now, sir.
Yeah, thank you, ma'am. Thank you
And
very much for
I
throwing
think
light.
for the details of the school, details of the program and all, maybe Arundhati ma'am will give, but just what I want to add is, it's a 2-year program, and it's a trimester based program. As I said, every alternate term, students will be doing a hands-on project live in a hospital or related to hospital. So that way, by the time they complete their 2 years, they'll be almost having up to 8 months of real-time experience in healthcare management.
Yeah, thank you very much, Vandana ma'am. Now I invite Arundhati ma'am to speak why healthcare management. Where do they get the opportunities? Who are eligible for this course? What is the process for getting admission to the Anurag University if they want to take admission at our place at Anurag University?
Yeah, I think, thank you, sir. Thank you for giving me this opportunity to speak about healthcare, which has been my passion in life. I've spent all my life in healthcare throughout. Uh, and I've been working in healthcare management space for the last 25 years, teaching students. And we've seen a increased requirement of healthcare professional managers to run healthcare industry per se across, not in just terms of if I have to categorize healthcare into four main groups, which are actually the most happening industry in the world today. One is the pharma industry, the other healthcare pharma, then healthcare provider space, then healthcare payer space. That is like your insurance. Then you have healthcare IT space, which is actually facilitating both providers and payers together in an IT segment. So these are the four healthcare spaces actually, which have developed or having a very high growth rate currently. And then when we were working on the kind of manpower required for this growth, and we identified the gap. For example, in a study where we said that we need actually around 3 people for every 1 lakh population as healthcare managers. Then we looked at the current requirement based on the number of colleges who are providing healthcare management. We have around 0.7 people available. That creates a huge gap. This is as per the census and the data collected in 2019, which is still much more now with the advent of two major initiatives by the government that have come up. One is the healthcare management, healthcare insurance program called PMJY by Government of India. Then again, the National Digital Health Mission that is initiated with an objective to create a healthcare record, an electronic health record from womb to tomb for every citizen of India. Now, these two big initiatives actually opened up huge requirements in these two spaces. And we also see a constant growth of uptake of health insurance by populations. Initially, the uptake was somewhere around 8% 10 years ago. Now we are at 16 to 18% of healthcare insurance uptake. This is apart from the government insurance system that is provided. So there's a gradual increase of uptake of health insurance by public, which requires a professional management to drive these insurances. So there's a huge opportunities in all these sectors, and we have very less resources to actually cover these requirements. This gave birth to this initiative of coming up with a professional healthcare management course, which provides the skills and the competencies required for the industry as the industry requires today, both in private and public health space. So the whole program is designed from that perspective, running as a 2-year program, focusing on working on the ground. Apart from just theoretical skill and competencies, we are working on trying to post all the students in their respective industry. Some people work in the hospital, some from the health insurance space, and then some work in the IT space, so that they get a hands-on experience during their course in the during the program, so that they'll be ready to go to market without any time gap that is there required for them to present. And then we also have a plan to bring the people from the industry to come and teach us rather than professional teachers. There are some subjects that are taught by the regular faculty, but most of the subjects that require the industry experience, the whole course is designed in such a way that we bring the industry experts from the market and then teach them the practical requirements based on the current developments in the industry. Every day you see a new development happening in healthcare or new development happening in technology. So we take care of that requirement by calling people from the industry. That will help students in 2 ways. One is we actually make the students interact with the industry. So that will make the industry connect with our students during their college days, not after that, during various internship programs or the time where they did, so that the industry people know our students and they actually pull our students. So we are working on a pull mechanism of students rather than pushing them into the industry. So we prepare the students for industry requirement, and industry uptakes our students for placements. So this is the whole objective with which the whole program is designed. And there's a huge market available today, because that's the industry that is growing exponentially across all the other major industries is healthcare. So I think it's apt and timely venture that we should embark on healthcare management, provide the guidance to healthcare industry, and ensure that it gets into the stage where it has been envisaged for. This is from my side, sir. Any other questions any students have? It's a 2-year program with 4 internships, where you'll be placed in various hospitals, insurance industries, where you can go through. Any questions, anything that you have?
Who are eligible for this course, madam? One student is asking, no, what is the eligibility to join this course?
We are looking at any science graduates who have some basic knowledge of life sciences, so that it is easy for them to connect with healthcare. So they are familiar with the healthcare words, so that we don't have to train them on. So the basic eligibility is graduation in health science, any life sciences. They are eligible to take up this program. Who understands life sciences language, understands this, can take up this course.
Very good. Thank you very
It
much.
could be a pharma student, a physiotherapy student, a nursing graduate, or a medical graduate, MBBS graduate, or a graduate from AUSoM, a pharma, a nursing professional, a physiotherapy professional, or even a BJC student who understands basic biology is eligible. From an engineering perspective, if the student has done an engineering, they can join, provided they're ready to learn the healthcare concept, but it will be little tough for them compared to a life sciences graduate. But somebody who's really interested in IT system, healthcare IT systems, and who wants to learn the domain of healthcare IT, they can join. but then they will be restricting themselves to healthcare domain in their IT space. This course will help them to get into that domain and make their career of healthcare IT.
Thank you, ma'am. Thank you for sharing that now. All the Ayush doctors like Ayurvedic, Unani,
Yeah.
allopathy, homeopathy, Siddhi Yoga, all these doctors are eligible to take this course, and
Yes,
also
sir.
all the life
Yes.
sciences students, as well as pharmacist background students, B Pharm C, Pharm D, Pharm D, PB, and all. Thanks for that. And there's a
Nursing
question
also,
that
sir. Nursing and
nursing and
physiotherapy also. Physiotherapy students.
physiotherapists also. Thank you, ma'am. And there's one more question, like what kind of skill development can we expect in this course?
So we will give them all the competencies and skills that are required to manage a hospital in terms of streamlining the hospital operations, understanding the standards of healthcare systems, both in insurance, healthcare operations of hospitals, healthcare IT standards, and then they will also understand uh, quality systems that they need to build in the hospital. So what are the ethics? What are the business laws and ethics that are related to healthcare, which they comply to? Because where healthcare is becoming more legal day by day. So they will learn all that as part of this program, apart from the regular concepts of HR, finance, marketing, and then supply chain management. They will also learn how healthcare practice is done in terms of healthcare operations, driving, establishing a hospital, uh, how do we do hospital planning if somebody is want to establish their own hospital? What is the planning requirements of hospital licensing requirements of establishing? All that will be taught as part of this.
I know that now this fee structure, one student is asking about the fee structure. The fee structure is compared to any other institutions, even though we are giving a lot of value addition to the students. 2 lakhs per annum is the fee structure for this course. There's one more question for you, Arundhati ma'am. The question is, what are the diverse career paths that we can expect through this healthcare management?
See, if you want to get into hospitals, you can go as healthcare managers in hospitals, both in the public sector and private sector. If you want to, if you're interested in public health, you can go as public health experts, work in NGOs as public health experts, work with them, take uh, design various programs, work with governance, designing policies. They can go as a consultants there in that space. And then if they want to get into healthcare insurance market, most of the insurance space, like for example, if the person takes an health insurance, we need to have something called pre-authorization done, right? Somebody is authorized to take it. So most of the pre-authorizations, claims management, review of claims, all these positions or job roles are done by healthcare managers in the insurance space, health insurance space. And in terms of healthcare IT sector, design of healthcare IT applications. Who else will be better than these people who understands healthcare domain so well, who will be hand-holding the IT teams to design healthcare IT applications, which is the most happening growing market, IT market. If you look at IT growing market or IT domain, which is growing today, is healthcare. So
Thank
these
you. Thank
people
you.
will be there in that space as well. They'll be implementers, designers, trainers in healthcare IT.
Yeah, there's one more question, ma'am. Like, I know that no, the salary is always based upon their competency and all, but still there is a question. So I thought of asking you, uh, what they're asking that what kind of salary package that we can expect.
So it depends on the background of the student and then how will they perform and where they are going. Like public health has a different set of salaries. Private health has a different set. Health insurance is a different sector, different set of salaries, and then healthcare IT also has a different. So you can't average them out and then say that. But I'm sure much higher than a regular MBA because it's a niche based product. They will be much higher than getting as a higher MBA guys. And then if you are a medical graduate with an MBA, you will be much above. So they get, like most of my students today were passed out 5, 6 years ago are CEOs of hospitals. So you can understand and estimate what could be their package.
Thank you, ma'am. Thank you very much. There is one more question. What are the major job roles we get after MBA Healthcare Management? I think ma'am has answered that question. Sir, we would like to know that whenever we get into the course and all, who will be our professors and what kind of learning that we can expect from the course?
So, for basic concepts of marketing finance, we have good in-house faculty. We have professors of practice who have rich experience in teaching them, and our regular faculty whose base topics will be taken by them. And for all industry papers, like for example, quality in healthcare. Quality in healthcare, we will bring people who are external assessors of NABH. Now, NABH is a healthcare accreditation program, the topmost healthcare accreditation program in healthcare industry. So we will bring in external assessors who have worked as external assessors in NAPH will come and teach us quality. Similarly, healthcare IT. We will bring people who have worked in healthcare IT space will come and teach us healthcare IT. Informatics, people who have designed healthcare standards, who have worked in healthcare IT standards will come and teach health. So based on the relevant module and topic, we will bring the people from the industry. We have a completely listed out people who are willing to come and contribute to us. We have already created that list. And they will come as and when required. They will come. There are a lot of CEOs and CXOs who are willing to come and share their knowledge to us. We have already worked with them. So whenever there is a requirement, we will just get into an MOU and then they'll come and share with them. Similarly, for internships, they will all be based across the industry, not only in Hyderabad. If the students wants to go out of Hyderabad, we can also place them outside Hyderabad as well.
Just to
Always
add
is a
to
question from the
Professor Arundhati, the School of Management has close to 40 professors,
Yes.
out of which almost 11 people are from the industry. There are healthcare entrepreneur who has worked in a healthcare IT entrepreneur is there one of the professors. So apart from that, with Arundhati's connection, we'll bring people from all over the country.
Yes.
That is another one. Apart from that, let me just share with you, we have a Nilima Institute of Medical Sciences and Nilima Hospitals. They're attached as a part of the Anurag University. And I'm happy to share that they will get an opportunity to work hands-on. Just across the building, one can go and learn from that. So in terms of getting people, this program, let me just share with you, the School of Management is probably the topmost school in all of South in terms of the industry expertise that comes to the class. Nowhere else anybody can claim the number of professors of practice. So these, just to add to what Professor Arundhati talked about.
Thank you, sir.
Thank you, sir. Thank you for throwing light on that. With this, I'm sure that we were able to clarify the objective of the course MBA Healthcare Management, and all the students and the aspiring healthcare management professionals, especially the doctors, pharmacists, nursing, and life sciences students, and those who are eligible for the course. You are always welcome to visit Anurag University campus, and also if you need any kind of guidance, we are always there to help you out. And also, if you are interested to take the admissions, you can visit the admissions office. Before I conclude, I would like to know from Vandana ma'am, because the teaching learning practices, as Arundhati ma'am rightly said, that most of the times it is the industry practitioners that will be teaching, as Balaji sir, Vice Chairman, Nilma Institute of Medical Sciences shared. I would like to know that what will be the assessment model. Vandana ma'am, could you please throw some light, because I always listen that at Anurag University, School of Management has got different practice in assessing the students. Could you please throw some light, madam?
Yes, sir. Thank you. The assessment pattern at School of Management, as you said, is it's more of formational. We assess in a continuous internal evaluation. It will be 8 80% internal assessment and 20% as a external one. The reason being, we want to see the learning happening of the students on a day-to-day basis, how much they have learned, and take the feedback. See what if we have to change them, give them any further training through tutorials or learning experience or so on. So 80% will be internal assessment through various assignments, quizzes, and participations, activities, etc. 20% will be a formative exam. Sorry, summative exam at the external. And also for healthcare management, as it is industry members who have to come and teach for those subjects which are related to healthcare, it will be in module based teaching, sir. It's like it's not like 1 hour a day, but it will be like a continuous teaching by the expert for a week or 2 weeks on so that makes that the student gets in-depth knowledge from the expert, and they can it's not a partial learning to them, and assessment also will be continuous.
Thank you, ma'am. Thank you very much. I request all the uh, viewers who are watching on YouTube, you can type your question in the chat box so that if there are any queries that we have, we'll be able to help you out in clarifying those questions if you have any. And apart from that, if anybody has got any questions, also you can type in the even Zoom chat box so that we'll be able to answer them. We'll be we'll be taking 4 more minutes in order to take the questions if you have any. Before that, if anybody would like to add value, also you can add value. For this, I'm sure that we could tell that who are eligible for this. Number one, all the graduates who have done, postgraduates who have done their courses in life sciences, nursing, physiotherapy, allied courses, and doctors, as we said, that Ayush doctors, pharmacy students, life sciences students are eligible. And the fee structure, relatively, as this is the first batch, we are offering it for the to have a lot of value addition. We are offering it for 2 lakhs per annum.
Yeah.
Now,
The
I don't know, I can share this, like when it comes to the general, anywhere you do this course in any other institution, the fee structure will be 5 to 16 lakhs per annum. And I'm sure that as this is the first batch, so we would like to go ahead and encourage the students to join for the first batch. That's so fee structure. And as rightly said by Vandana ma'am, it's not a theoretical course, it's a practical course where the courses are being taught by the professors of practice as shared by the Balaji sir. And it will be a hands-on course where you'll be doing it. And as also he also shared that our vice chairman sir, who is the of Nilima Institute of Medical Sciences, he also assured that even the placement or the job offer is not an issue because we do have our own medical college, and we are training many people into that area, so that placement is not an issue. And of course, we believe at Anurag University, especially AUSoM Dean Balaji sir, believes in practical skill based training rather than outdated obsolete programs. So modules also, as Madana ma'am shared. So those who are watching this YouTube, also you can type your questions in the chat box so that we'll be able to answer them. We have 2 more minutes.
While they're typing questions,
So
let me
please.
just share with you that I was involved in setting up the world's largest health helpline and a telemedicine service for Andhra Pradesh and all over the country. We set it up in multiple places. We also ran the world's largest mobile health delivery
Yes.
program. Close to 1 million hypertensives and diabetics were served. Close to 1 million pregnant women were served. And I was also involved in designing the 108 ambulance service. And I'm happy to share Professor Mohammed Rafi also is here in the group. He worked with EMRI, 108 ambulance services, as a manager. So public health need not necessarily mean you work in a hospital. You can also work in services like this.
Yes.
All of you can save lives. It is not just making money. You can also feel good that you could help somebody survive. If you can send an
Yes.
ambulance within the golden hour, you would have saved a life.
Yes.
So millions
Yes.
of lives were saved thanks to this. The whole technology architecture was developed by us. I was there involved while the whole benchmarks were set up, that a
Yes.
call should be picked up in 3 rings and an ambulance should go there in 25 minutes. All these standards were set up. So this is a very specific, like Professor Arundhati said, very niche kind of a thing. We have to understand what it means. Similarly, we created probably, like I said, world's largest health helpline, where we saved almost 500 lives. Young people and other people who were feeling depressed, they required psychological help. To close to 500 people were saved from committing suicide. So technology is compared to the technology 10 years ago. Today, we have point of care devices, a lot of electronics,
Yes.
and we have AI. So since we are a university, one advantage is the students will get an opportunity to learn from engineering school, from the pharma
Schools.
school, from the medical school, from the nursing school. So this all nowhere else they'll get an opportunity like this. Other institutions are just focused on one. So we give a very broad-based kind of a teaching and learning. That's an opportunity that students would get. So if I was young, I would have joined this course again.
Yes, sir.
Of my regular
Uh,
MBA, I would have joined this
yes,
course.
thank you, sir.
Thank you very much, sir. Hats off for saving a number of lives,
No, please.
and
Completely.
the man behind the world healthcare management, and also 108, 104 EMRI.
Uh,
I know, and really, we are glad and also proud that no, you have been guiding these students and to make better healthcare professionals in their life.
there is one question by Mr. Robert Nirmal Joseph. If you can see in the chat.
Yeah, this is Robert Nirmal Joseph, Regional Licensing Officer, Care Hospitals, Hyderabad. Like to know any MHM or MBA programs for working professionals in future.
Yes.
It's a good question,
Robert.
Mr. Robert. You get 8 of your colleagues will run a special program for you.
Yes.
See, at
Thank you.
Anurag University, our founders believe in democratization of education, and we don't want to. In India, we talk education as Saraswati. We don't want to come in the way of anybody learning. If you want a program in the mornings, because working professionals through the day they are working, and evenings Hyderabad traffic or any city's traffic is unreliable, we are offering our BBA and MBA programs in the morning. We'd love to offer between 7 to 9. Maybe instead of 2 years, we may slightly extend it by 2.5 years or so, or we may manage within 2 years since many of you have experience. We would love to offer
Yes.
that course, but there's a minimum of 8 to 10 people are required for us for the logistics and other things to work out. We'll be very happy to offer that course. Anything to help the
Health
health
industry.
industry do better. If you
Yes.
can help, even because of the learning that you take from us, you save one life.
Yes,
I
sir.
think Janma Dhanma in Nataga Telugulo,
Great.
something like that.
Absolutely.
See, we
Absolutely,
are
sir.
not gods. We can't create lives. We can't give life, but we can save lives.
Save lives.
So I really compliment Dr. Robert for raising the question. Definitely, we will offer that.
Yeah.
We are planning to offer.
Yeah.
Thank you,
Uh,
Balaji sir and Vandana ma'am, for clarifying that out. No weekend programs. Yes, rightly said. Balaji sir has answered that, and
yeah.
I think there's one more. What about the internship program for HCM course?
So the last semester is completely for internship. They'll be posted in one of the places of their choice, whether they want to work or specialize themselves in hospitals or they want to specialize themselves in public health or health insurance or healthcare IT, depending on the choice and the interest of the students. They'll be doing the internship there and then they can plan their career forward in their specific area of interest. There's a
Ma'am,
huge scope and it's a very serious learning, not a very easy to go course because it's completely focused serious learning to the needs of healthcare industry today.
Yeah, it's okay if you get your car one day late, but you
Yes,
can't
sir.
handle a patient, keeping them
Exactly,
wait
sir.
just a minute
Exactly.
or two, because doctors
Yeah.
will say, 10 minutes pehle laaye to I would have saved the life kind of a thing. So we understand this very serious business,
Yeah.
and therefore we look for serious students, and our process will be tough. If you have seen a film called Officer and Gentleman, Richard Gere, you will know how it is. We love our students, but we're tough with them, just like we call it tough love at the School of Management.
Thank you, sir. Thank you. And also, no admission process is like if anybody is interested, they can reach School of Management Department or directly to the admissions department at Anurag University, and so that we can talk and take the admissions based upon your small interview. Will be there with the team, and then the selection process happens. The moment you are selected, you need to submit the required documents like your graduation documents, and then we'll be. You need to pay the fees. You can pay the fees online or cash or whatever the mode that you are interested in. You can do that. The fee is 2 lakhs per annum is the fees. It's a 2 years course.
Yeah, I think it's a steal, if you ask
Yes,
me,
yes, rightly said, sir. Because as you know
because it's
that the 5
deeply
lakhs to 16
discounted.
lakhs, it's only 2 lakhs. It's
Yeah,
a
yeah, because
steal, as you rightly said.
that's again because of our management who are very keen that make education affordable. We don't
Yes.
want people to take student loans and be indebted. It doesn't make sense. While we are waiting for any more questions, I would like Rafi to quickly share his experience as a manager in EMRI 108. How many lives did he save, and what was the average time the ambulance took when he ran it? I'm not saying the quality is the same today, but when he ran it. Rafi, are you there? Rafi, I think is in mute. In any
He's on
case,
mute.
he was a manager. He was managing few ambulances. He was a regional manager in MRI, and he left his corporate job to join EMRI. He was selling photocopiers in Modi Xerox. I'm sure he was making a lot of money, but he felt like contributing to the society. He worked with EMRI. So I think it's a wonderful thing. Like Professor Arundhati mentioned, the health industry is a little backward in terms of adopting latest management practices and IT. So there's a fantastic opportunity in terms of contributing. Rafi, you came quickly. Don't take more than 30 seconds. I think Srinivas has a time hard stop for him
Thank
to
you, sir.
manage. Professor Srinivas, yeah. Would you like to share a few things, Rafi? You have to unmute yourself. पावर चला गया आपके पास?
Rafi,
So,
sir, could you please unmute you and speak?
Yeah,
You are on mute.
yeah. Now
Please
he's
go
on.
ahead, sir. You can speak. Balai sir has requested you to speak about the services at HMRI.
EMRI at EMRI.
EMRI, I'm sorry, sir. EMRI.
That your role, how many lives have you saved? What are the average time it took for you to deliver,
Yeah, am
send
I
the
audible, sir?
ambulances? Yeah,
You're
yeah, you're
audible,
yes.
audible.
sir.
Yeah. Sir, during the course of my job at EMRI, one thing which I noticed, though I was not from a medical and health background, the type of respect which I used to get whenever I used to attend the meetings, and the type of joy and the type of satisfaction you get in this job, because every effort you put, that will ensure you will be striving towards a mission of saving lives. So there we had the culture of working 24 cross 7 cross 365. So it gives immense satisfaction to work in health industry.
It's God's own work.
Yeah. Just to give you the current status, we had an accident on Monday, just in front of Anurag, and we were there and we were trying out the ambulance. Ambulance came within 15 minutes. We did the CPR to that patient on ground. We tried to save that patient, and then we called up ambulance. Myself, Rafi, we were there on the spot just behind the ambulance. So we stopped ourselves and looked at, and then I think it's still working, sir. Good.
I'm happy because the stretchers and all designs were done by my team. Some of
Yes,
the
sir.
volunteers from Satyam,
Yeah.
they designed the chair stretcher and all of that. When we designed our mobile health services, our people got the parts from 5 continents and 16 countries to reduce the weight of the vehicle, to increase the mileage, so that for the paramedics we could give air conditioning. These are the challenges, nobody thinks about. I think we can. India is a jugaad country, but there's a long way to go. We have to create world-class standards. But in ambulance services, let me tell you, we are as good as some of the best in the world.
Yes, sir.
Yeah. Anyway, any other questions? Back to you, Professor Srinivas.
Thank you, sir. Thank you very much, sir. I think we do not have any more questions. Once again, I request all the participants who are interested, they can visit Anurag University at any point of time. And I'm sure that no, as Balaji sir rightly said that no, we are here to make the society a better society. That's the reason the management has accepted to go ahead with 2 lakhs per annum is the fee structure. Where I don't think it's a peanuts. The value that we are giving and you're paying is in peanuts. And thanks to Balaji sir for persuading the management to introduce this course and run this course for the betterment of the society. And I thank Arundhati ma'am and Vandana ma'am and all the professors of practice and all the professors who have joined, and also all the students who have taken your time in the evening and you are attending this. I'm sure that please spread this message to others so that the person who are interested to pursue their course in healthcare management, Anurag University doors are always open. Once again, I thank Balaji sir for making this time to be present here and talk about, because we missed all those things, sir. Thank you for adding them.
Thank
And it has been, I can say that, enriching because of your presence, and also the way you
Thank you.
also made Rafi sir to speak about his experience and expertise. And we welcome you to the team anytime. Please do come to the Anurag University and grab the opportunity. Uh, as is said, as rightly said by Balaji sir, it's a steel deal where no you're getting for 2 lakhs per annum is the fee structure. With a lot of modules, 10 modules or 24 modules, you get the course in modules where experts from the healthcare management are going to come and speak, industry experts, where you don't get that opportunity in any other universities, I can say that. And of course, Arundhati ma'am herself has got more than 3 decades of experience and expertise. She's been in lot many panels, including ASCII and all other reputed hospitals. She has been there in the panel, and also as a resource person and delivering many courses for that. With this, I thank each and everyone for making your time and making it to happen over here on this evening, rainy evening. I think it's raining outside. I thank each and everyone for your participation and for your time. Thanks a lot. I
Thank
wish
you.
all the students who have been aspiring to become the healthcare management to thank you and also invite you to the university to grab this opportunity and take the admission at Anurag University. Thank you. Thank you so much. Have a great time.